If you have plantar fasciitis, stop. Don't get the cortisone injection, and let me tell you why. Cortisol is released in your body, that's the natural form of cortisone, when there's a lion in the room, when you have stress. The body thinks, okay, I might lose a limb, I might be without a food source, so it sends cortisol to break your tissue down and convert it into glucose so that your brain can stay alive in a horrible situation. However, when you inject it into a tissue, it can stretch out that plantar fascia, but there are long-term concerns about the weakening of that plantar fascia. Even I've had a lot of great treatments in the past using some very painful methods on people to help the plantar fascia, but I have something better now. I'm Dr. Adam Fields, I'm a chiropractor, and I use the Piezowave, and it is incredible. Let me tell you why. Your inflammation down here in this beautiful pearly white ligament is not normal inflammation like from an infection. There aren't a bunch of white blood cells congregating there to heal an infection. It's actually more of your body's inability to adapt to stresses. The intrinsic muscles of the feet not holding the foot up, the calf being too tight. People like hospital workers standing up all the time, teachers, construction workers, people that are using their foot to hit the brake and the accelerator a lot. That tissue can't repair. It's in a state of inability to repair and being injured over and over and over, and it's degenerating. So there's tissue failure, literally tissue rot in there. So why would I want to break it down more with a corticosteroid? This machine, however, sends sound waves into the tissue, and it actually brings blood into the area, and actually it causes a little bit of an inflammatory response so the body can take it through a healing process and actually regenerate the tissue. Let's not degenerate, let's regenerate. Regenerative medicine, it's a big buzzword. The Piezowave actually does it. It's amazing. I've been doing it regularly in my office on the plantar fascia for people. In fact, there's a lot of studies, but there's one study that is interesting, the piezoelectric focal waves application in the treatment of plantar fasciitis. They said the treatment with piezoelectric focal shock waves in plantar fasciitis may reduce pain from the first session and achieve a subjective perception of improvement, maintaining these results at least 6 months post-treatment. And I like how the study said subjective, but also we're getting histological changes. It has been shown to regenerate tissue, even reduce the size of the bone spur. So I'd love to get you running, jumping, and on your feet again. Let's do it.